Hello and welcome to the Surgical Spirit podcast. I'm your host, Dr. Al-hakim, the Third Eye Doctor. Pull up a chair and get ready for some candid and uncompromising discussion with experts, innovators, agitators, and influential people from every corner of health and well-being. From inside the hospital to at home in the kitchen, we're leaving no stone unturned in our quest to uncover the secrets of healthier, happier, more successful, and less stressful lives. Thank you so much for joining us, and without further ado, let's meet this episode's guest. Hello Mahib, how are you today?
I'm really well, Haider. Thanks for inviting me on.
No, it's great to have you here. I know you're a super busy guy. I mean, you've got so much on your plate. How do you sort of put it all together and still have that smile on your face?
I think the biggest thing that helps me do that is that I love everything that I do. And, you know, it sounds like a cliche, but, you know, they say that if you find a job that you love, you never work another day in your life. So I am really busy, but all the different roles I do, I've picked things that I'm excited to go and do them, that I'm passionate about. So, you know, I love my education work, but like, for example, yesterday I was clinic. I love to see patients. When I'm teaching, I really enjoy that. If I'm traveling to do humanitarian work, I'm really interested in it and you know, learning from the people that I'm around and the environment. So I think if you pick things that you enjoy doing and you're passionate about, it doesn't feel like work. And so that definitely helps.
And where did that come from, that sort of need to do something that you love and have passion for?
Well, I think, like people sometimes talk about work-life balance. The thing is that I don't see that as a clear. For example, if you run your own business, you know, there's always something going on. You're never really off, are you? So if you're going to spend a long time doing something, I think it's important you find something that you enjoy doing, because otherwise, if you see it as, oh, you know what, it's a slog, I've got to get through this to get through the week and then I can relax, then, you know, if you're going to do something for 20, 30 years, for most of the day, you're there more than you are with your family. If you're not enjoying it, what's the point? That's my sort of mentality. I'm going to spend a long time doing it. So I found things that I'm passionate about that I enjoy doing. So then I'm happy when I'm at work, and that helps me be happy when I'm not at work. You know, like I love to spend time with my friends and family. I love to spend time with my kids. But obviously, you've also got to do something in your work hours so that you can earn a living. But I don't think that should be something that you really don't like to do, but you're just doing, because then over time, you're not going to enjoy it. And I think things like it will then translate into the way you do your role, you know, especially, for example, when I'm seeing patients, if you're not happy in your job, sometimes you might find subconsciously that it might affect the way that you actually interact with your patients, and you know, it might sort of rub off into that. And I hope not to get in that situation. And if I see it building up, to try to do things to prevent it.
Which is quite amazing, because when you read the news and you read the papers, it says that the majority of GPs are unhappy. So you're part of the minority of GPs, maybe. I don't know.
Something I had about that is that actually you're right. You know, that they're well documented that there are large levels of dissatisfaction, stress, burnout. And that's because there's so many pressures. You know, GP is such a busy role, and especially the last sort of decade or so, I'd say the workload's gone up. The number of patients per GP has gone up. The number of visits per patient per year has gone up. The number of GPs has gone down. We're doing a lot more. I remember, for example, when I was sort of a medical student, the majority of patients with diabetes, the minute they needed insulin, would refer them to hospital, and they'd be sort of, you know, under an endocrinologist and manage that. Whereas now, hardly any of our patients, even the ones on insulin, need to be seen regularly by a hospital consultant. You know, so much more is managed in GP. So, you know, the workload is phenomenal. So I can see that. But one of the things I will say is a lot of the GPs that I see that are happy are the ones that are doing portfolio roles, that aren't working, say, 9 clinical sessions, because it is really tough. That, you know, the pressure one patient after the other, and then the admin that comes with it, it is very, very intense. So I think those people that have, they say a change is as good as a rest, that they might still be, almost all of them are still working full-time hours or more, but where you have something to break up your working week, like, for example, you might be teaching. One of my friends, he's doing clinical work for some of the week, but then part of the week he's the team doctor for the England under-18s football club. So he'll go to their training camps, he travels when they're doing tournaments. He just breaks it up a little bit.
Oh, so it breaks that routine where you have to get used to that change, or it just the mind has to flip in a way and change roles, and that causes you to sort of adapt and I'm trying to be flexible. I think that flexibility is interesting, isn't it? Having flexibility in your life.
Definitely. I think it's one of the beautiful things about having a portfolio career as well, is that, yes, you've got to do that adaptation. But sometimes, like, for example, if you're finding a particular thing is quite intense and well, okay, I've got this for 2 days, but then on Wednesday I'm going to be doing a different role. You've got something else to look forward to, or no matter how challenging it can be, that something else is coming, and it will just give you a break, and then you can come back. Like sometimes you're having a particularly challenging clinic. If tomorrow you're going to be doing a different role in a different setting, and then when you come back, you'll have another clinic the day after. It sort of allows you to reset.
Which is why having that kind of work and non-work and fun and not so fun sort of different task, just to keep things moving for you, essentially, rather than just sort of doing the same thing over and over again. And which is quite interesting because I did a lot of cataract surgery, and then I got to a stage where I got bored with the surgery because it was the same old thing over and over again. And if I'd break things up and just done something totally different in between, it may have sort of kept my passion going. Where did you get that passion for sort of GP and sort of education work?
So actually, when I finished my house jobs, I was thinking about leaving medicine entirely.
Wow.
Why? I found house jobs is a lot of running around doing paperwork. You weren't often really thinking that much, and it was a lot of, you were given a set of tasks to do, and you just had to do them. Take these bloods, go and chase these x-rays,
a dog's body. I feel like a dog's body.
Absolutely. You know what, there's lots that you learn,
sure.
Lots of things you have to do, but I did find that I found that by the end of that year I was getting a little bit fed up of that. I just wanted a different challenge. So one of the things was, when I did my ALS, they recommended I go for ALS instructor training, and I started teaching medical students, and I really enjoyed that.
ALS is Advanced Life Support.
Yes, thanks, Hada. And actually, I had a job lined up to go and teach at a Caribbean medical school to teach communication and consultation skills, which is something I was really interested in. But then I saw this master's program at UCL to do health informatics. And I'd always been interested in computers and in programming. And I thought, what, this might be an option if I want to go into consulting and, if I wanted to leave clinical medicine. And I couldn't really afford it because I just finished my house jobs. And I managed to get a scholarship from one of the research councils. They basically paid the whole thing. So I thought, okay, I'll put that job on hold. I'll do this.
How'd you get that? How'd you get the scholarship?
So it was just
application.
One of the tutors said, apply for this, you might get it. So I had to fill in an application as to why I wanted to do this. And thankfully, they funded the whole thing.
Wow.
And so while I was doing that, I kept locuming. I was doing orthopedics and trauma. So I would locum, and then I'd attend a few days a month to physically attend. The rest was by distance learning. Last 6 months, it was dissertation. So I didn't have to attend at all. So I thought, I'll take a full-time job. And I took a job in a hospice. And I absolutely fell back in love with medicine. And I saw the beauty of how, because one of the things in hospital, sometimes there can be a lot of politics, and there can be, sometimes egos can get in the way of actually the patient. And what I saw in the hospices, from the CEO to the cleaner, everybody had one focus, and that was to serve the patient and to, make sure we could do everything we could to make them as comfortable as they could and to make sure that their needs. And there's also this mentality that, you don't want to do an investigation unless there's a really good clinical reason. So it made you really think, what am I hoping to find from this, rather than, when you're a house especially, it's very easy, isn't it? Just to tick every box. You're taking some bloods anyway. Using LFT, serum banana, serum rhubarb. Let's get a bit of that. Hope something comes up, and then see what. Whereas in the hospice, it was the complete opposite. You wouldn't do any test unless you could really justify that it's going to benefit the patient. There's going to be a good reason, or what are you going to hope to add? If you can work it out without doing it, don't bother doing it. And so actually, I loved that you had to really think, and that everything was focused around the patient. And I just saw how teams could work, and how it was really, really wonderful. One of the best jobs I ever did. So I thought, I don't want to leave clinical medicine. I don't ever want to lose this. But by that time, I'm coming to the end of my master's, and I thought, you know what, I did my dissertation was actually around cancer pain management and building an interactive learning tool. So I was thinking, I've learned about developing websites, and I'm interested in education and teaching. I want to keep that up. I don't want to miss that, but then I don't want to stop seeing patients. So how can I put these things together? And I thought, you know what, with GP, there's that flexibility to develop a portfolio career. So that's really how it started. And then once I got into GP, a lot of people were asking advice. How can I get into training? There were these new assessments being developed. Instead of the old traditional interviews, they had like this selection center. They're using these new types of assessment. So I just made a website giving out information about this, all free, lots of different articles. And so many people were sort of asking the same questions. We thought, well, if we'd maybe put together a course, maybe people would find it helpful. And that's how basically Emedica started. We ran that first course back in 2005.
Wow.
And then once those doctors got into training, they were like, oh, well, actually, I'm doing membership now. I need some help with that. And by that time, I'd done membership. So, we thought, okay, well, we'll start doing some courses for that. And then they developed sort of communication skills-based assessments to get into GP training. People wanted help with those things. So, we put together a course for that. And it grew and grew, basically, and got to a point where I was working full-time clinically, Monday to Friday, and then teaching a lot of weekends. And then when I wasn't teaching, I was traveling because I was newly married. So I was traveling to visit my in-laws or visit my parents, and just got to a point where, you can't work 7 days a week for so long. So when I finished my own GP training, I made a decision that, look, let me try full-time being my main role in education. And I'll keep working clinically maybe 1 or 2 days a week so that I keep my skills up. And then if it doesn't work out, I've got to, I've kept my skills up, and I could maybe consider a full-time job in practice. And basically, I loved it. It took off, and that was 11, 12 years since I made that switch to portfolio career, but with the main role being in education. And since then, we now teach medical students. We teach, careers for people who are finishing. We've had examiners come on the course. So a whole range of different things.
What difficulties have you sort of experienced going through this sort of transition from GP to sort of full-time-ish education, medical education work?
I think one of the things that's challenging is that when you're teaching something, you have to really, really know it well. And so I spend a lot of time reading, researching, trying to keep up to date. And especially these days with technology, like you got to be, even the day of the course in the morning, I'll make sure, is there anything new? Because if you say something, someone will be on their phone and be like, oh, actually, that's changed. And, like the technology is in everyone's hands now. So I think the amount of time you have to spend researching and keeping up to date, because I think one of the things that sometimes people might say is like, it's these many days that someone might be teaching. And then these many days I'm in clinic, because we opened a practice a couple of years ago, myself and one of my best friends that I went to medical school with. We'd always talked about doing something together. And a couple of years ago, despite both working full time, we decided, let's open a practice.
Wow.
And it's the fact that all the days when I'm not doing either of those, there's a lot of other work that goes on in the background. So you always got to be keeping up to date. So always got to be reading, always got to be sort of, researching what's happening. And things like exams, they change, the structure of exams change, but then all the clinical stuff that we teach, guidelines are always changing, aren't they? So you're always having to keep up to date with that. And that's one of the big challenges.
I guess that's also a sort of a stimulation to sort of enjoy the work as well, if you look at it that way.
Yeah, I think the nice thing is, if I'm reading to keep up to date, it's useful then when I'm seeing patients. But then also I think the other way, that I think that when you're seeing patients, if you're then teaching things like consultation and communication skills, you can relate it to an example that you saw maybe last week or the week before, which makes it easier for you to teach, but also it makes it more real. When you're teaching to a registrar, that they can relate to what it's like when you're trying to put it in real life, because there might be like the ideal standard, the perfect consultation.
Sure.
But then there's how do you adapt that to when you're running behind and it's a busy clinic, and you've also got all of those things to do. So I think that the two definitely help each other.
Yeah. I mean, having real life stories helps all the time, to teach anything, and having lots of examples of sort of real life situations, and when you're exposed to it on a daily basis, it makes it interesting for you, and it makes it interesting for everyone else who's sort of learning from this. How do you think education has changed for medical students? I mean, we went to medical school a long time ago. How has things changed for the medical students? For the better or for the worse, or is it sort of...
So I think
I know it's a big question.
Yeah, well, I think lots of great things have come from technology, and so I think there's a lot more opportunities now for students to get really rich. There's lots of 3D modeling and things like, for example, for anatomy, where there's so many apps now, you can actually layer by layer peel back and actually see what's there and try to get those connections. But also in teaching, so we started live streaming a lot of our courses now, and recent courses we had a doctor logging in from Saudi. We had someone in Dubai, we had someone in India, someone in Pakistan, someone was logging from Portugal. That 10 years ago, they just, it wasn't possible. The internet connection wasn't fast enough for you to stream HD video and stream the slides at the same time with good quality. It just wasn't possible in most settings. Whereas now, that's amazing. We do some webinars where there might be hundreds of doctors logging in from all over the world. And so I think, the potential to reach people that you couldn't do before. But similarly, for students to engage with others, on one of our Facebook groups, for example, we'll post educational topics on a daily basis, some video clips and things like that. What's amazing is how helpful someone will ask a question, and there'll be someone the other side of the country or sometimes the other side of the world who say, I had something similar and this helped. That I think was when you and I were in medical school would have been impossible. We didn't even have smartphones, so never mind.
We did feel isolated essentially. It was really your mates, and if you're lucky, if you were a bit tech savvy, you'd be on the internet for a bit and sort of find out stuff on the internet. But apart from that, it's literally your mates in medical school or mates elsewhere in other medical schools, and that's it. But now, the opportunity is immense, and I guess, but the amount of information is a lot more. There's a lot more diagnoses and a lot more treatment plans and protocols and so on. So, I mean, there's just so much more information now, and something that people always ask me is how do you store all this information? I mean, are they still going with memory like for us back in the day, or is it more application of principles now when it comes to medical school and sort of exams and so on?
Well, I think there's bits of both. You still need to know, your core basics. But for example, I write questions for the prescribing safety assessment so final year medical students sit. But for example, they have access to BNF now, which is good because, because
we have access to BNF as doctors as well.
Absolutely. In real life, when are you going to be in a situation? It's very rare where you need to make a complex decision and you just need to know the dose off by heart. You'll be able to look it up. So yes, it's still time pressured. So they still need to know that, okay, the general treatment for this is is this, first line treatment for someone who's got hypertension and who is under 55 and not Afro-Caribbean. It's an ACE inhibitor, but do I need to know the exact dose? No, I'll know where to look. I can still look it up, but you still need that basics, because if you had no idea which section to look, then you're still not going to be able to. It's going to be too slow, right? But so I think that's good. Things like that, where you need to be safe. You need to know how to. The key skills are, I think, perhaps a lot more important. So being able to consult well, being able to communicate well, knowing the basics. After that, if you know where to research the specific details, you'll be able to do that. Now, I think that we'll probably see that a lot more. That this idea of, I think it'd be good in a day where eventually you could do an exam, and they actually let you have internet access and let you, actually search for some of the answers. You still need to know the basics so you know what to search.
Sure,
otherwise, you're not going to get through it in time. And I think that the skills will become more and more important rather than just repeating, regurgitating facts, if you like, applying them to a situation.
So in your view, what are the important skills that you think are essential as a medical student and as a GP?
I think being able to consult well. So that one part of that is being able to communicate well, but one part of it is also knowing what are the right questions to ask so that you can do a good job clinically, and to do that in a focused way, given the time constraints that you've got. The essential skills of like examination, they're never going to go away. You still need to learn those things. And I think one of the things sometimes when you are early on in your medical student career, you don't see the value of things like anatomy. That how important it is that and physiology, that how the body works, and I think being able to put that all together. So I think consulting, communicating well, but also increasingly I think using technology to be able to enhance what you can do to be able to help the patient better, and then teamwork. Medicine's a team sport, right? They always tell us that. But I think that whether you're in GP or whether you're in hospital, that is such an important skill, be able to work with others. And I think, if you put the patient at the center, and I think it goes back to my experience at the hospice, that, every member of that team, they're working towards one common goal. The cleaner, the nurse, the physio, the pharmacist, the CEO, the doctors, everyone. And I think that's a really, really important skill.
Wow, that's absolutely amazing. It's been quite a sort of whirlwind of a tour talking to you today, and it's really amazing that you still have that drive and passion and do so many different roles with gusto, and with a big smile on your face. And that's something that I've noticed about you. You always have a smile on your face, which is absolutely amazing. How can people get hold of you? What's the best way for people to sort of know about the work that you're doing?
Yeah, so you can contact me on Facebook, LinkedIn. Easiest way is drop me an email through the website. So that's emedica.co.uk. If you go on there, contact details are there. Anything that you send through there, you can get hold of me. During office hours, if I'm not available, my team will take a message, and then it will get to me. So whichever way, I'm happy to. If anyone needs any advice, support, if you've got any questions, if you want to become a GP or develop a portfolio career or interested in medical education, always happy to connect with people.
Thank you so much. It's been a great pleasure speaking to you, Mahibur.
Absolutely, Haida. Really nice to speak with you, and all the best with your different ventures and all the different roles that you hold as well.
Thank you so much. Bye-bye.
Thanks. Bye-bye now.
Thanks for listening to this installment of the Surgical Spirit podcast. For all the latest in the world of surgical spirit, don't forget to follow on Twitter at The Third Eye Doc, and catch me on Facebook at the page The Third Eye Doctor. You can visit the website at www.thethirdeyeDoctor.co.uk for more information on the work that I do. And please send us feedback and questions and suggestions for the podcast. It's always a pleasure to hear from you. I've been Dr. Haida Al-Hakim, and I'll see you next time.